Los Angeles Unified has in place the highest set of safety standards of any school district in the nation. Air filtration systems have been upgraded in every school, and the air is filtered through the equivalent of an N95 mask 24 hours a day. Schools have adequate supplies of masks and protective equipment. Custodial staff has been increased to keep schools clean and safe, and all students and staff on campus are tested for COVID regularly. These safety measures will stay in place when the new school year starts in August. Since this crisis has started, we've advocated for what we've called a Marshall Plan for schools to make sure schools have adequate funding to help students and the families they serve. And thanks to actions and leadership by Governor Newsom at the state level and President Biden at the federal level, this has become a reality. Schools in Los Angeles will have record amounts of funding for each of the next several school years. These additional funds will allow schools to add literacy and math support to help students build a foundation in these critical skills in elementary school. Secondary schools will add more teachers to provide individualized instruction. Children's schools will benefit from additional mental health services, while students with learning differences and disabilities will receive more direct supports. And all schools will be cleaner and safer with the increase in custodial staff. For the first time in decades, there's sufficient funding to do all of this. But all of this efforts to help students rests on the foundation of the safest possible school environment, and vaccinations are a critical piece of that. The vaccinations are safe and they're effective. The world-renowned Cleveland Clinic tells us more than 99% of patients they've treated for COVID since January hadn't been vaccinated. On any given day since schools reopened in Los Angeles in April, there are as many as 200,000 people on our school campuses. All are tested on a weekly basis at schools for COVID-19. Los Angeles Unified is the only school district in the country which is providing this level of protection. During an average week, less than 0.1%, or about 30 or 40 people, are testing positive for the virus. We have systems in place to notify anyone testing positive so they can safely isolate at home and keep the virus from spreading to others in the school. Since students returned to campus in early April, only one case has been identified of possible spread of the virus in schools. That case involved 2 adults, neither of whom had been vaccinated. Last week, with the support of the state and the governor, we launched one of the most ambitious efforts in the nation to provide vaccinations to children ages 12 and up. We're operating 26 sites at schools in underserved communities, and in addition, mobile teams of clinicians are visiting all 250 secondary schools in Los Angeles Unified over a 2-week period before the school year ends. And we'll repeat this again during the summer. This effort's off to a great start. Many thousands of children, along with their family members, have already come to school for their first dose of vaccine, and they've reminded us how much difference access to the vaccine at a trusted location in the neighborhood makes. More than half the people we help at schools just walk in without an appointment and get vaccinated. This matters most in the communities served by Los Angeles Unified, which have been disproportionately impacted by COVID-19. The families we serve have suffered the highest job losses, the highest level of illness and death due to the virus, and they continue to struggle with housing and food insecurity. A critical piece to address this disparity and the best way to provide access to vaccinations for children is at their local neighborhood school. Families can look forward to August and a new beginning. We know the best place for students to learn is in a classroom at school, and we will continue to do all we can to make sure school classrooms are as safe as possible. I cannot tell you how important this effort is the governor is bringing to our community to make sure all have access to the vaccine, all understand the importance of being vaccinated, and all are encouraged to participate. Thank you, Mr. Governor. I'd like to introduce Congressman Jimmy Gomez. The federal government has been working tirelessly alongside state leaders to make sure we have all the resources we need in schools, and there is nobody I know who works more in support of the students and families we serve than Congressman Gomez. Congressman Gomez, please.
Good afternoon. First, let me thank Superintendent Buettner for welcoming us to this high school. Really appreciate his partnership. And I also like to thank Governor Newsom. Everyone enjoys a good comeback story, and we love them because we see ourselves in them. In these stories, we recognize our shared resolve, our collective determination, and our enduring will to triumph over adversity. Comeback stories remind us that despite our hardships and misfortunes, there's always an opportunity for a second act. And right now, when it comes to COVID-19, there's no better comeback story than the state of California under the leadership of Gavin Newsom. California has already administered millions of vaccine doses, and they're just getting started. But this comeback story is still being written as we speak, because we still need our state's young people and adults who have yet to be vaccinated to play their part in turning the page on this pandemic. These vaccines are the key to California's comeback story. Vaccines are safe, effective, and widely available across the Golden State. We all miss socializing with each other. We miss the warm feeling that comes with spending time with our friends at our favorite taqueria. We miss the sounds of live music at Microsoft Theater and cheering on the Lakers and the Dodgers. These experiences that we all cherish are only a shot away. So please, if you're eligible, get your COVID-19 vaccination today and help us write the final chapter of California's comeback when it comes to this pandemic. Aquí en el estado de California hemos administrado millones de vacunas, pero todavía nos faltan millones de jóvenes y adultos que no han sido vacunados. La vacuna es clave para poder ver a nuestras familias y amigos con seguridad. También es clave para ir a tu taquería favorita o ver los Dodgers en persona. Y como hijo de inmigrantes, yo sé que muchos de nuestros padres en familias inmigrantes vinieron a este país para una mejor vida y para tener más oportunidades para sus hijos. Esa oportunidad está aquí, es seguro y es gratis. Vacúnate hoy. And with that, I would like to introduce the governor who is leading the California comeback once again, Governor Gavin Newsom.
Thank you, Congressman. Thank you for your words. Mr. Superintendent, thank you for your words and your work as well. I'll brag on both of you a little bit more in my remarks, but I just want to thank everybody for being here a day after we intended to meet. In fact, it was this time yesterday that I had hoped to be making the announcement that we're making today. Obviously, fortunate circumstances in Northern California and San Jose kept me away from making the announcement that we're making. And obviously, goes without saying, as we continue the investigation, learn more about the motivations behind the shooting and the tragic loss of 9 human beings, that we are mindful that we have family members and victims that have been devastated, lives torn asunder and destroyed, and we want to continue to be mindful of that, even in light of what I believe is a very positive and important announcement that we're making here today. With that, I want to pick up a little bit on what the Congressman said. I appreciate this framework around a comeback, because California is not just coming back, it's roaring back. It's important to note, and I saw President Biden today making remarks in Ohio about the economy in the United States. The economy in the United States has been disproportionately advantaged and aided by the state of California. Just consider last month, the new unemployment numbers came out in the state of California, showed 38%, close to 40% of America's jobs came out of the state of California. In some ways, that's not surprising. If you looked at the February jobs number, 41% of America's jobs came out of the state of California. As the Congressman said, this is a comeback story. The state of California no longer burdened, as the superintendent interestingly was bookmarking, by the challenges of scarcity. Now we'll be in the challenges of abundance as it relates to funding. Unprecedented record amount of funding going into K-12 education, going into education broadly, early childhood education as well as higher education. By one estimate, $46.3 billion more for K-12 education just in the next 3 years, simply without precedent in California, American history. And so I want to acknowledge the superintendent's remarks and the opportunities we have, and more importantly, the responsibilities we have as adults and caretakers, as stewards of our next generation, to be there for them, to address the issues of making up for some of the loss in learning, making up for the lack of opportunities to learn over the course of the last year. But I'm here mindful that none of that is possible and none of that is achievable unless we continue on the pace that we are on in terms of vaccinating all eligible Californians. Here's the good news. California has the lowest positivity rate in America. California has the lowest case rate in America. California has vaccinated more Americans than any state in America. Over 37 million doses have been administered in the state of California. Put that in perspective. The next number of doses that have been administered in any other state is less than 15 million, less than what the state of California has administered. We have administered more than all but 5 nations in the world. California has outpaced the nation in terms of the average percentage of population that has been vaccinated. Roughly 2/3 of all adults now have been vaccinated, and we are well on our way of not only reaching that 70% number that President Biden has advanced, but we're on the way of doing that well before that 4th of July date that he has set. That said, we have seen a reduction in the number of people looking to get access to this vaccine. I'll just point out, in the last 3 weeks, 2.1 million people got vaccinated. About 2 million people 2 weeks ago, 1.9 million people in the last 7 days. That's not even close to where we were at peak, just shy of 3 million people over a 7-day period. So we're starting to see a decline in the total number of doses administered on a weekly basis. Not as precipitous as some other states, but we are mindful that if we continue down this path and this trend, we're not going to get where all of us need to be. And that is north of 70% of all eligible Californians getting administered doses of this life-saving vaccine, or to get our kids back in person 5 days a week for full instruction, to get our economy moving and humming across every sector and every industry. We need to do more, and we need to do better. And so what we are announcing today, we think, is significant in advancing and achieving our goals. The state of California today is announcing the most significant incentive program in the United States of America. We're putting aside more resources than any other state in America, and we're making available the largest prizes of any state in America for those that seek to get vaccinated. Today, we're announcing that we are setting aside incentive cards, 2 million incentive cards on a first-come, first-served basis for individuals that are eligible to get a vaccine, that seek to get a vaccine. That's effective today in the state of California. If you're 12 years or older, you can receive a $50 incentive card from Kroger's, Albertsons, or if you choose, just a traditional MasterCard $50 card that will allow you to utilize those dollars anywhere. If you're a family of 4, you do the math. If you're a family of 6, do the math. That opportunity avails itself to everybody until we exhaust those 2 million cards. So that is a $100 million incentive program, and we hope to distribute all those dollars before June 15th. And indeed, we are prepared, and we believe we will be ready for that June 15th reopening fully of the economy here in the state of California, moving beyond the blueprint, moving beyond the purple, red, orange tiers, now moving back to that semblance of normalcy all of us have long looked forward to. So $100 million we're putting aside, $50 gift cards available today for anyone that has not been vaccinated to have that opportunity to be vaccinated. It's a digital card. You'll receive a text message or you'll receive an email, and after your second dose or the first dose of the J&J, you'll actually receive those proceeds, those dollars. But we recognize that's for new individuals. What about everybody else that did the right thing? What about you? 2 weeks ago, 2 months ago, took the time away from work, waited in a long line, maybe drove 50 miles into another county and got vaccinated, and gave us the momentum that put us in the position we are today, again, with the lowest case rates and the lowest positivity rates in America. We also want to give you a chance to be rewarded, and that's why we're doing 2 significant things. On June 4th and June 11th, Friday, June 4th, on Friday, June 11th, the state of California will be conducting a drawing. Everybody that has been vaccinated in the state of California will have their name put into this drawing. They are all eligible. And all of those of you before those dates that get vaccinated, I hope you're paying attention. You get the $50 incentive card, and you have a chance to be in a drawing where we will be pulling the names of 15 individuals that will receive $50,000 cash prizes. We'll do that on the 14th, and again, 15 individuals, $50,000 on June 11th. All of that leads up to June 15th. On June 15th, we'll be distributing an additional $15 million. On June 15th, we are going to make available to 10 individuals, everybody that has been vaccinated in the state of California, with a few caveats, and I can talk through those caveats, but the vast majority of Californians eligible that have received a first dose, those that seek to get a first dose before June 15th, $15 million that night will be distributed, $1.5 million prizes for 10 individuals. So these are real incentives. These are an opportunity to say thank you to those not only seeking to get vaccinated as we move forward, but also those that have been vaccinated since we first availed those opportunities a number of months ago. This is all in an effort to incentivize and build momentum and put a date with some expectation that by June 15th we'll move north of that 70% threshold for adults, and that we can significantly increase the number of 12-year-olds that also are eligible. All 12-year-olds, 13, 14, 15, 16, and 17-year-olds eligible for the full $1.5 million. I know some other states are just putting aside education dollars. We want to do that, and that $1.5 million can be for your education. You can start a business. You can dream a little bit differently. You can help support your friends, family. You can do the right thing and set aside most of that money, maybe give it to charity, but that will be your decision on the basis of those dollars being set aside for you on your 18th birthday. But all children 12 and up will also be eligible for those prizes. We're doing that in order to encourage you, not only with that $50 gift card, but with this significant prize and incentive program. So it's multifaceted, $116.5 million we're setting aside for these efforts. Those gift cards, again, those incentive cards will run through till we run out, 2 million of them. And then we have some ideas. Don't ask me because I'm not prepared to tell you. But we have more ideas coming after June 15th. But we want to see how far this takes us before June 15th. We've seen the success in a handful of other states of these incentive programs. I had the privilege of being on with governors from all 50 states on Tuesday, and we were sharing best practices in incentives. And we're incorporating some of those strategies, but we're doing them in our own California way. You don't have to register to do this, as is the case in other states. You're automatically registered. You don't have to receive the prize. Some people may be sheepish. We also keep your name confidential, as your name rightfully should be confidential, unless you want to make it public. So we put this together very thoughtfully, thoroughly. Been working on it for, dare I say, over a month. We've been pleased by the pace of distribution and administration of the vaccines, but early this week, really on Sunday and Monday, we started to see that decline, which raised the opportunity for us to raise awareness around these incentives and put them to use and make them real for millions and millions of Californians that are eligible. I encourage you to go to myturn.gov. We also encourage you to go to COVID-19.ca.gov website for more information, COVID-19.ca.gov. And as always, that 1-855 833, number 422-4245. That's 833-422-4245 to learn about approximate location, including here in schools large and small, thanks to the superintendent's leadership, as sites and points of opportunity to just walk in and get vaccinated without even having to schedule. We're going to be doing more on pop-up sites. We're going to do more on mobile sites. We're going to continue to do more with community-based organizations. 480 now we've contracted with to do in-language, more cultural competent outreach to address the equity gaps that continue to persist. We're going to do more by extending hours of operations for vaccines. More transportation for vaccines will be provided, not just incentives. And thank you again to the LA Unified School District Superintendent and the school board for their outstanding support of opening up these school sites, which we also think is a game changer in terms of providing the capacity for people to really feel comfortable and confident because these are sites they know, community members they respect and admire, and a sense of community as we advance our public health goals are also advanced at these key sites. So that's the, forgive me, long-winded introduction to what we think is a very significant announcement in the state of California. Hope people avail themselves to these opportunities, and I can assure you it's going to put a smile on the face of people right now that are unaware of it next door in that gym. They're all eligible now to receive those cards and incentives that had no idea when they walked in that those dollars will be soon in their accounts. So with that, we're happy to answer any questions, and I'm pleased as well to have Dr. Galley, our Dr. Fauci, here today to answer any questions as well.
Governor, Chris Ancarlo with KFI News, and the question I have, you kind of touched on there at the end, which is you've been working on this for about a month. Was there a specific threshold you were looking for to go ahead and roll this program out? And it also seems as though you're targeting less affluent neighborhoods that have seen lower vaccination levels. Is that the case? Yeah,
we continue to work hard. As you know, California was the first state, and I want to thank the congressman who was, early on in my ear saying you got to do more and do better, and he was right. To achieve the issue of equity, and you can't do that in large-scale sites. I think there was a lot of push and attention early on in this pandemic as it relates to vaccine distribution, these large-scale sites, but it was self-evident. You go to those sites that we weren't meeting our diverse populations, and we needed to go mobile. We needed to meet people where they are, regardless, by the way, of their immigration status. And Congressman, regardless of your immigration status, you're eligible for these incentives. We want everyone from a public safety and public health paradigm to get vaccinated in our state. So we have more work to do. 85.1, that's the number, millions of dollars, $85.1 million we put up to invest with our community-based organizations. You're seeing more promotions, more in-language outreach efforts. We're building on the work we did for the census. I met a young promotora leader, remarkable woman, who's working here, knocking on doors. Met a number of people that are part of our GeoTV program, Get Out the Vaccination, not the Vote program, doing phone banking. People quite literally, when we say meeting people where they are from an equity frame, literally walking the streets and just saying to folks, if you haven't been vaccinated, do you want to take advantage of these opportunities? Now they'll be aided by these resources and this very significant incentive of $1.5 million and this $15 million drawing on June 15th. But as it relates to the last few weeks, interestingly, we have held pretty strong on our administration of doses, and that's why we didn't move earlier. But this last week, we started to see, particularly in the first shots, what's held up is the second shots. So it's actually made it look as if we're doing better than we actually were in terms of total number of administered doses. But it's those first doses, those first shots that are way down. And so you can see that cliff coming in the next week or two. And this is what we're trying to mine and trying to address as it relates to the announcement today.
Hi, Governor. Brian Melley with the Associated Press. I'm wondering, in your wildest dreams, did you ever think you were going to have to spend $116 million to incentivize people to take free shots to prevent a potentially deadly disease? And what do you say to people critics that would say that that's bad spending of public dollars?
Well, I think the worst spending is burying your head in the sand and continuing to do what you've done and not achieve the goals of getting all of us back on our feet, and keeping people healthy and safe. Look, Point being, the cost of not getting vaccinated is exponentially, incalculably higher. I don't think this, I know this. Just ask the Treasury, federal Treasury, the cost associated with this pandemic. Ask people in the state of California the costs in terms of business interruptions, the cost in terms of the opportunity not to be back in school for in-person instruction. We can't afford to run, forgive me, the 90-yard dash. We got to finish the job. And what we're seeing here is that 10%, between 20% of Californians eligible getting the vaccinations and 30%, that was easy compared to getting from 60 to 70%. Getting from 70 to 80% will be even more challenging still. So this is about as, I think, wise a use of resources as we can identify in terms of a public health emergency that needs to be tackled head on. And we are still in that state of emergency. This disease has not gone away. It's not taking Memorial Day weekend off. It's as deadly as ever. Ask the dozens of families who lost a loved one just in the last 24-hour reporting period to this disease. It continues to take the lives of Californians at all ages, not just the very old. We know that young have been impacted and have lost their lives to this disease as well.
Hello, Governor. Susan Hirosuna, Fox 11 News, a.k.a. Alex Michelson's subordinate. I have this question for you. Is there any projection on how much these incentives will work? There is a behavioral economist that suggests that monetary incentives are only somewhat effective.
We worked with UCLA. They just put out a study. Their estimate is 31% of people that they surveyed in their research said this makes them, quote unquote, more likely to get vaccinated. Now, there were some interesting components of that research that did look at the issue of socioeconomics, looked at the issue of race, ethnicity, that also showed across the spectrum that people would be more likely to be vaccinated. Nonetheless, we're mindful that this is novel, though not as novel as it was just a few weeks ago. Again, you've seen states that are handing out Girl Scout cookies, some that are handing out fishing and hunting licenses, some that are doing $20 LL Bean coupons, some that are doing shots for shots, quite literally shots for shots. So people have been iterating with incentives, and increasingly you're seeing a number of states, 5 or 6, with these larger cash grants, and we have seen some enthusiasm in those states, and we want to see if we can replicate that enthusiasm here.
Governor, Margaret Carrero, KNX Radio, thank you again for taking questions. Estimated 12 million people eligible in the state for the vaccine have not gotten it yet. How many people do we need to get vaccinated to get past that 70% mark? And for the $1.5 million prizes, do people need to be fully vaccinated or just have the one shot and be on their way? Yeah,
it's one shot. Now remember, J&J, you just need one shot. But the vast majority of people are using the 2-shot regimes for Pfizer and Moderna. Remind you that Pfizer is the only one that currently has the emergency use authorization for 12 to 15-year-olds. We expect Moderna to shortly get that same emergency authorization. So that's a 2-shot regimen. You get the actual incentive card at the end of your second dose or the first dose of J&J, but everybody after their first dose is eligible for those Friday $50,000 prizes and drawings, and for the $15 million June 15th pool of $1.5 million for 10 individuals.
Hello, Governor. My name is Julio Ortiz with Univision, Channel 34 here in LA. If I'm undocumented and I become vaccinated, but I don't have a social security number, and I become the winner of this lottery, how do I claim, or will I have issues claiming that prize?
Yeah, we're working through those details, but this is eligible for all Californians, regardless of their immigration status, that got vaccinated with at least one vaccine. You'll be eligible. We have your information in our system. The exceptions include those at CDCR, incarcerated, those that were vaccinated but are not residents of the state of California, those like me, in the GEO, what they call GEO offices in the state of California, folks at the Department of Health. You got to mind folks at the Department of Health, and then a number of other categories. We included not surprisingly, folks in the state lottery that work for the state lottery, others that we just felt were appropriate not to be considered. We're working. There's one interesting caveat. The database for the VA is different from the state database. We're working to try to address some of that. So there are some issues in all of this. No one's being naive about this. We're doing it at a scale it's never been done. But we are also aided and supported by the experts at the lottery, though this is not being run through the lottery. It's not the lottery. But we have the expertise in terms of the veracity of the process and obviously the dual responsibility and considerations as it relates to all things public health and all of the confidentiality that comes with your public health and your desire to see that that information remain confidential, and we are committed to that as well.
Hi, Governor. Jen McGraw with KTLA 5. Is California having to offer more incentives and this historic funds because of the slow vaccine rollout?
Quite the contrary. California has already administered 37 million doses of vaccines, 15 million more than the next best state, Texas. It's one of the top administered dose states in America. It's number 2 in large states. By the last estimate, number 12 of the 58 states, the highest in terms of percentage of population. So quite the contrary. We just want to continue to do the job. We're seeing a significant decline in some of those southern states, and we want to continue to accelerate our efforts here. Good enough never is. And California wants to continue to lead. And I'll remind you again, lowest positivity rates in America, lowest case rates in America, a $75.7 billion and growing operating surplus. We'll enjoy the highest reserves in state's history, and we're enjoying an economic rebound that allows us to confidently say the state's not coming back, it's coming roaring back.
Hi, Governor. I'm Tom Waite with CBS Los Angeles. I'm told I'm your final question. So first, a logistical question, and then just go back to Margaret Carrero on the sort of magic number that we need to get to. Is there a way, my first question is there a way to sort of get people who have already been vaccinated, how do they verify just to make sure that they're in that registry, that they can get these incentives? And then just Margaret's question about reaching that threshold, what number, that's that magic number you're looking to get to?
Yeah, a couple things. So you're automatically in. People that have gotten vaccinated had to go through a process and a protocol where their names are already secure. I can just say this, confidence, if you want to get vaccinated again, you think you're going to have your name in twice, it's not going to work. So don't go back and get vaccinated again. Won't make any difference. Period, full stop. So you don't need to game that. We have a process protocol. It's called CAIR, C-A-I-R. That process protocol is well established here in the state of California, working with counties large and small up and down the state. There is a lag in terms of that data collection. And so for those, as we get closer to June 4th, I would just encourage you, this is my own humble opinion, because of that lag, try to get these vaccines earlier. Take advantage of this 3-day weekend. Take advantage of the ability to walk in, even here, this high school, and just walk right in and get a vaccine. Not only you get those $50 incentive cards, your loved ones can get them as well. Your friends, extended family members, maybe you've been vaccinated, but you want to encourage them this weekend to get vaccinated, do so. And the sooner they do it, the more likely their names will be in the hat on the June 4th drawing, the June 11th drawing, and then again on the June 15th drawing. So if you're disappointed on June 4th, you didn't win $50,000, you got June 11th, your name will be automatically in that pool, and then again on June 15th. So we're driving to June 15th. There is no magic number. We believe we'll get well in excess. Look, we're almost there. 2/3 of adults are already received at least one shot in the state, so we'll get north of 70% unquestionably. But we've got to incentivize folks to do so. We had 163,000, people get administered doses yesterday, which was decent, but as I said, over 2/3, I didn't say this, but I did say the vast majority are second doses. Over 2/3 are the second dose, just to reinforce that the second dose is really driving those numbers, and so they could be a little misleading. We've got to get those first dose numbers up, and each and every member of the public can do that, and now they have more of an incentive, more of a reason to do that. I want to thank the other governors for their ingenuity and innovative spirit. Thank you for their example. I want to thank our team for organizing these prizes and these incentives. I want to thank each and every one of you in the state of California, 40 million strong. Everything that was just said is because of your grit, your hard work and your tenacity, more importantly, your resilience. Thank you for this privilege. And again, to the superintendent, thank you for the great work you're doing with these school-based sites. And to our Congressman Gomez, thank you for all the federal funds that have long had a framework of focus that we care deeply about, our North Star, equity. And that's a big part of the announcement today as well. Thank you all.